Hi, I'm Dr. Julie Steinauer. Let's talk about fatigue of your vision system after lots and lots of computer work and near work. Boy, if the last 2 years of your life flattening this curve hasn't, well, a year and a half, hasn't caused you to have problems with your vision because of all the excessive computer work, I'm not quite sure that it ever will. But whether you're an adult or whether you're a child, you may experience a lot of problems with your vision as a result of all of this computer time. You know, whether you had to do your work from home or whether your student had to do their work from home, or maybe it was a hybrid system of some stuff at home and some stuff in the office or at school, we all learned that there's a whole lot that can be done on the computer. However, we also all learned it can cause us a lot of problems. So it's not unusual for people to be experiencing things like double vision, blurry vision, headaches, eye strain, problems seeing clearly at the end of the day. These are dry eyes. These are all things that are potentially things that you've noticed in the last year and a half. Now, before I go into it even further, I'm going to stop and I'm going to tell you how to connect with us. You can call us if you're local at 618-288-1489. If you're not local, please go to our website at visionforlifeworks.com and either fill out the questionnaire or schedule a consultation. We, as an office, process so many requests every single day via email and phone call. We literally cannot even get to them every single day, and it's getting to the point where we can't even get it to them oftentimes after a week. So we are very grateful for all of you connecting with us, but if you're not local, the fastest way that you'll connect with us to answer your questions is going to our website and either filling out that questionnaire or scheduling a consultation. Okay, now with that, let's go back and talk about like all the things that people are experiencing from lots of computer work. As I mentioned, double vision, blurriness of eyesight, either like when you're looking at the computer screen or when you're trying to drive home at the end of the day, or maybe your student is trying to, see out the backyard at the end of the day after being on their computer all day long or being on their gadgety phone device, right? Oh, I would show you my phone, but of course it's right here. I've done too many videos. Okay. All right. Where's that? Where's my glasses? They're on the top of your head. All right. So if you experience things like, headaches or eye strain. Headaches can come in lots of different forms. You can get them kind of like right around the eyes, all around the eyes. You can get them at the temples, top of the head, back of the head. You can get them all the way down your back and neck and shoulders and all of that, depending on what's going on for you and how much time you really did have to invest sitting in front of a computer screen or a phone. So there's lots of things. You may figure out that you've had a deterioration of your eyesight. Like, you feel like maybe you need a little bit of a stronger lens even. These are all things that are pretty common. What do you do about them? And, how do you prevent this thing from happening? How do you get back to better vision? Well, I'm going to give you a couple of tips and tricks on things that are simplistic that I want you to just try out just to see. First of all, it's really important that you take breaks from the computer screen or from the screen on your phone, whatever gadgety device that you're using. And so, in optometry, we like to try and be clever, and there's this rule of 20/20 because it goes with 20/20 eyesight. However, I'm weird and I don't like that rule, like at all. Because one, it's not even something that most people will do. The 20/20 is kind of like trying to say, like, after 20 minutes, take a 20-second break. 20 seconds, first of all, is worthless. So that's my first problem with it. But second of all is that people are not going to take a break every 20 minutes. I don't care if it's gadgety, cool, catchy, whatever you want to call it, it just doesn't work. So instead, I like to think about it as like either a 30-minute or a 1-hour rule. And this is more realistic and it works a whole lot better. So what this is that if you have something that's super intensive, maybe you are a person who develops apps, Or maybe you're an accountant who's on the computer all the time. Or maybe it's your student, who's like, okay, they're like 9 hours on. The rule is at the end of 30 minutes, you want to take a couple of minutes of a break. Now, I'm a little loose on this one in terms of I don't say you've got to take, every 30 minutes, you got to take 3 minutes worth of a break, right? That's going to make a good thumbnail for this. Okay, all right, so that'll be my clip for this video. But you want to take at least a couple of minutes of a break and look off at distance. Get away from this short-sighted thing that you're doing with your gadgety device, with your laptop, with your iPad, whatever, and look off out a window far away and let your eyes relax. Because what happens is when we focus up close for too long, there's a muscle inside of the eye that's kind of it's called the ciliary muscle, and it's involved with our focusing, and so it will kind of tighten down and pull, as well as the muscles around the eyes, like the lateral rectus, medial rectus. Okay, I could talk about all of those muscles, but some of those muscles will get kind of tight if you're constantly pulled in and crossing your eyes to line them up to a target for long periods of time. So you need to relax those muscles. You need to relax the ciliary muscle, kind of get it to kind of unclench or contract and let it loosen, all right, by looking far away. That's one thing that you can do. If you're doing it on the hour, then every hour you want to take at least 5, maybe even 10 minutes of a break. This is like go get a drink of water, go to the restroom, stare out a window. Think about what you need to do next for your day as you're looking out the window. Make it purposeful. Okay, I've got to do this, 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 this. All right, especially if you're working that way, it doesn't look like your boss is coming by and you're like, what are you doing every hour? You're staring for just 10 minutes, just like blindly, off in the distance, like, do something purposeful during that time. Again, if it's your child, same rule kind of applies, either every 30 minutes or every hour. And then at the end of the workday or at the end of the school day, you can't go back to nonstop screen time. That doesn't work. You've not really given yourself a break. You can't go from all day instruction online to all night long staring at a phone. It just doesn't work out so well. All right, so you also need to limit the screen time and the things that you're doing outside of what you really truly need it for. Now, I know that stinks, especially if you've got a kid who's a video gamer. I know that stinks, especially if you're an adult who runs a business off of their phone, but you have to have some downtime, otherwise your vision will indeed suffer. Now, I don't think I've missed anything. Let me just think. Anything else we should cover in this video? If there is, drop me a question down in the comment section below this video. But the other thing I want to talk to you really, really brief is what do we do to fix these things? Let's say that you're like, okay, that's me. Computer vision syndrome is where I live. I definitely have that. All right, so in our office, we do 2 phases of therapy. Oftentimes, I show this one filter, not because you necessarily need it for your visual condition, but because it shows up good when we do videos. Just so you know. I have some people who are like, I didn't get the yellow filter. You told me I would need. Well, all right, not everyone needs the yellow filter. Okay, but first phase is syntonic therapy. Second phase is using the 2 eyes together and training the brain how to be efficient with the 2 eyes. It's a bit more mechanical in nature. So that's how we treat computer vision syndrome. And it doesn't matter anymore. There's no age that this, doesn't affect, because even really young kids like 2 and 3-year-olds can get it if they're on a phone a lot. Which can be surprising, or they've got a little iPad that they're doing learning stuff apps on. So it can happen to literally anybody, and you want to protect your vision. So now for more information, you can do a couple of different things. Contact us if you're local, 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and either fill out the questionnaire or click on the schedule a consultation button. Like the video if you like it, and also subscribe by hitting that bell icon for all of our videos. And also, if you find it worthy of passing on, pass it on to someone who could benefit. Thank you.